So, what is ABC of diabetes? Do you know that? Learn diabetes ABC. So, A stands for A1C, B stands for blood pressure, and C stands for cholesterol. Well, you guessed it, we are talking about diabetes management. Diabetes, like there are like 500 million people all over the world who have, who suffer from diabetes or manage and we are talking about diabetes type 2 with an American Diabetes Association Diabetes Educator today. Okay, so hang on for 1 second, and hopefully she should join me in 1 second. Thank you. All right, joining me from Ecuador, she is a diabetes educator, and we are going to be talking about management of your diabetes. Hi there. Hi, Elisa. How are you?
Hi. Good. And you?
Yes, great. Thank you so much for joining.
Of course.
Yeah, so I was just telling our the viewers that we are talking about management of diabetes type 2. And Elisa is a diabetes educator with American Diabetes Association, right? Elisa, do you want to add something?
Yeah, that's right. I've also done a little bit of health coaching, but I'm mainly focused on diabetes management and diabetes care. And I'm also a type 1 diabetic and
Oh
have
my
been
God.
for over 25 years. So yeah.
Oh my God. So tell me a little bit, before we go into the diabetes type 2, type 1, let's just understand the difference between type 1 and type 2 first, and then we'll go into the type 2.
All right. Yeah, perfect. Okay. So there's actually a huge difference between type 1 and type 2 diabetes. They're often confused to be one and the same.
Yeah.
And most people talk about, what's the worst and what's the best kind of diabetes to have. Usually people ask you, like, do you have the severe kind of diabetes, or do you have like the normal kind of diabetes, right?
Yeah.
And usually they're referring to type 2 diabetes as a being like the more manageable type of diabetes to have, and type 1 as more severe. But
Okay.
that's really far from the truth, right? Because they're two very different
Yes.
diseases in some senses, and in some others they're quite the same. So I'll start with the differences, okay? So one of the main differences is that type 1 diabetes is actually a autoimmune disease,
Okay.
right?
Yeah.
So that means that our genetic coding is such that we get type 1 diabetes. There is no known reason as to why we develop type 1 diabetes. Just genetics purely is all that we have to hold on to right now. The rest of the medical community agrees that there is nothing else that they can really put their hands on as to why we get type 1.
Yeah.
It is also very common, there's a theory about it being onset or activated by some sort of virus or some sort of happening in your life, but they still can't pinpoint exactly why and what it is, right?
Okay.
So that's all we know as far as type 1. The other difference is that when we get diabetes, right, since it's an autoimmune disease, our beta cells, they're called beta cells, and they're in the pancreas. So our pancreas is in charge of producing insulin, right? And the cells in charge within our pancreas of producing this insulin are called beta cells, okay? So the beta cells usually produce all the insulin that any human might need according to their lifestyle and what they eat, so on and so forth. But the difference is that when we get type 1, our cells attack our, the cells we get to defend ourselves from viruses, from bacterial infections, the cells that are usually good for us, basically don't distinguish between something foreign and our own beta cells. And so they start destroying them, okay? Until there are none left. And this happens within a very short period of time, okay? So basically, a type 1 diabetic can never produce insulin again, right? We have no beta cells within us, and so we have no possibility of producing any insulin at all. Okay, so all of our insulin is produced by isn't produced by ourselves, is all injected, right? Or infused by an insulin pump. So that's the main differences. Okay, so type 2 diabetes is actually really hereditary. Okay, if one parent has type 2 diabetes, you are 40% more likely to have type 2 diabetes yourself. And if the two parents have type 2, then you are 70% more likely to develop type 2 diabetes. So this also goes to say that if your parents, one or two, have type 2 diabetes, then you should definitely look into, right, getting a glucose test done, and definitely, you know, trying to look out for if you might develop type 2 yourself. Okay, so it's very hereditary heavy, yeah, and it's also genetic, right? So people always ask me, like, for example, if I eat a lot of sugar, will I get type 2 diabetes, right? And the answer is depending on your genes, right? If you don't have it within you, right, to develop type 2 diabetes, then there is no amount of sugar that you can eat that can actually make your body be diabetic, okay? But if you do have the gene within you, then yes, right, being overweight, actually, it doesn't matter if it's from sugar or not, but being overweight can definitely cause insulin resistance, right? That means the insulin your body produces starts to be less effective, yeah, and you start needing more and more amounts to be more effective. And this basically can develop into a pre-diabetes and eventually onto a type 2 diabetes. Now, type 2 diabetes, some people think it's reversible. It is not, 100% not reversible, okay? But the reversible condition is pre-diabetes, okay? So we really, we want to have to pay attention to what we're doing and what we're eating and our habits, right? If we exercise or not, if we're active or not, to maintain a lifestyle that is healthy and that leads to not developing pre-diabetes. That's basically, the big difference.
Now, I think that's very useful, right? For because people get confused what the differences are, and a lot of times, you read up, oh, I reversed my diabetes type 1, which is not true. Like you're explaining, it's not possible. You can manage it, right? You can manage it well, and that's what we want to talk about. We have only, like, these are small session, and this is an educational session right now we are doing, is that how can you manage it with nutrition? Like, so let's just talk about the high level thing. We don't want to go too much in detail. Like carb counting, right? So why is the carb counting so important for diabetic people?
All right, so carb counting, especially, I'd say for both types of diabetes, it's definitely more crucial for type 1, but both benefit from carb counting. Because by carb counting, we know how much our blood sugar will be raised. That's the short and simple answer.
Yeah. Okay. So that's why, for diabetics, it's very important to understand or monitor their carb intake on a daily basis so that the blood sugar is at the optimal level, right?
For sure. And definitely you'll have a lot more control of what you can eat and how much you can eat if you have the knowledge.
Okay, so let's talk about on a high level on the foods, the nutrition. So there's a glycemic index, right? So what kind of foods people who have diabetes, pre-diabetes, or what kind of foods should they focus on as far as the glycemic index is concerned?
Okay, so the glycemic index basically, what it tells you is how much or how quick, not how much, because that's the carb counting, but how quickly, your blood sugar will be raised.
Okay.
So you need both insights basically to make a very informed decision, how much it will be raised and how fast it will be raised, okay?
Yeah. Okay.
And that's what the glycemic index tells you. So the higher the glycemic index, the more it's similar to glucose itself. So we want to eat foods that have a low glycemic index in general.
Okay. So, and some of the foods would be with low glycemic index, some examples, like for 2 or 3 examples?
Sure. Okay. So within the fruit group, I would say any berry that you would like to eat, strawberries, blueberries, raspberries, these all have a very low glycemic index. Yeah. If we're talking about rice, I'd stick to wild rice. It has one of the lowest glycemic indexes. Yeah. And if we're
and then what about other herbs like cinnamon and
actually
so many other
pasta, the more it is cooked, and this is something very few people know, the more it is cooked, the higher glycemic index it'll have. So if you're gonna eat pasta, eat whole grain pasta and eat it al dente. So those are a few.
Oh, okay. So don't cook all the way through the pasta, right? Just, okay, the brown pasta, the wheat
Don't
pasta.
make it so that it's like very easily disintegrated. Yeah, try to keep it a little bit hard, a little chewy.
Okay. All right. So let's just talk about some of the herbs, like common kitchen herbs that can help with management.
Honestly, these are all like complementary to diabetes management. They're not specifically included in diabetes care. So this isn't like formal management. If you would like to take some herbs, and I've known some people that take herbs, I'm not against it. Like it'll definitely do you no harm. For example, cinnamon is known to stabilize blood sugar. It might help a little bit, but it'll never substitute your medicine or your insulin. So that's definitely important to note.
I see. So there are so many things like we read that you can manage your diabetes without medication. So is that true? I mean, people can get off medication or not? And if so, then what is the process? What is the framework for that?
Okay, so let's see. If you have pre-diabetes, yeah, most doctors will try to get you started on metformin. So yeah, you're less likely actually to develop type 2 diabetes if you're on metformin. So they give it to you more in a preventive way. But once you develop type 2 diabetes, even if it's just for your maintenance, usually you're kept on at least the lowest dose of metformin, okay? If you want to get off your medication, you need to be in target weight, yeah, definitely, have a very active lifestyle, and eat properly, okay? And that way you can lower the dose more and more, and that way your healthcare practitioner will let you know if you can go off your medication. Usually that only happens with pre-diabetes and not with type 2. But you can go, I've seen cases where the type 2 isn't as developed, yeah, because it's normal for type 2 to develop as the years go by. That can maybe go off medication for a while. But it is important to remember that your diabetes isn't better or worse according to the medication you're taking, okay? It's just what your body is asking for at that time.
Okay. So let's explain us a little bit about A1C, right? Why is that important? Like a lot of people are able to reduce their A1C levels, and what is the optimal level for A1C?
Yeah, for sure. So A1C basically is the average blood sugar for 3 months, okay? So it's your average within 3 months. So basically you'll get a percentage, yeah, and we'd like you to be in between 6 and 7%. So that's an in-target blood sugar, basically, which for type 1 and type 2 is usually between 80 and 140 or 70 and 140. So that's basically the target for us. Anything above a 7 or 7.5, depending on your age and the amount of time you've had diabetes, is, we don't recommend it. it can be susceptible to complications. But here's the thing. So A1C can be a tricky number. And this is why. Because even if I have a 300 and then a 50 and then a 300 and then a 50 again, and so all of those blood sugars are very off target, okay? But the average might come out to something that we can interpret as positive. So an A1C isn't all of the information, it is just some information. So what we're looking at now, and now that blood sugar sensors are actually a lot more popular, is time in range, yeah? And you'll get a percentage of time in range, and that is the most significant number as of today.
Time and range. Okay. So now that we understand if someone is pre-diabetic, it's easier for them to reverse it rather than if someone is a diabetic type 1 or diabetic type 2, but you can manage it, right? So what would be the framework on a high level, right? If someone, let's say, I'm not diabetic, but someone wants to have a natural lifestyle to manage their diabetes well, what would be the framework? Since you would recommend on a very high level, we're not going in details.
Okay, perfect. So let me just start off by repeating that type 1 and type 2 diabetes are not reversible. The only reversible disease is prediabetes.
Yes.
Okay.
Yes.
So prediabetes, requires different, let's say, components to be stabilized and hopefully reversed. The first of them is exercise, right? Okay. The American Diabetes Association recommends 150 minutes of exercise a week, yeah? So what we recommend is exercising 30 minutes per day at least, for 5 times a week. If you can do more, definitely do more, and try to mix it up between aerobic and anaerobic exercise, right? So one of them is strength training and the other is cardio. Okay. So try to do a little bit of both. The second is nutrition. So as we've talked about, watching your carbs, watching the glycemic index, and definitely watching for the quality of food that you're putting into your body. That's definitely important. And lastly is to keep a very close eye on your disease. So monitor your blood sugar, monitor your A1C, monitor your time in range, depending on your blood sugars and what your physician tells you. Take your medication, right? Just try to be on point. And lastly, I would definitely recommend watching your mental health, okay? Your stress, breathing, meditating, yoga, whatever it is you want. But stress, is a hormone, and insulin is a hormone. So they're affected by each other. And you will develop more insulin resistance if you are stressed. So definitely watch your mental health as well.
Okay. All right. So 3 things you talked about. Watch your mental health, which all of us are having problems nowadays. I mean, honestly, all of us are locked up for the last 1 year without much of social interaction. So mental health is very, very important. And it's challenging, right? So it's a bit challenging. And then the second thing we talked about is the exercise. Well, first thing you talked about the exercise. So exercise is strength training. There's a research as well, right? If you do like strength training and diabetes, there's a research paper that I had read, so that helps. And the third thing is nutrition, watching your glycemic index, making sure your blood sugar, you're counting your carbs properly, you're eating that. Those are the 3 main things, right, that we are talking about in managing your diabetes effectively, we should say that, right?
Yeah, exactly. Okay. It's an integral approach.
Okay. Anything else you'd like to add for viewers? All right. Someone is asking question. Yes, indeed. Mental health, it all begins. Okay. So mental health, yes, absolutely. Anything else that you like our viewers to know about diabetes management?
Okay. Depending on whether you're a type 1 or type 2, the pandemic has definitely taught us to be careful and be mindful. Yeah, we are definitely more susceptible with COVID to develop worse. I'm trying to think of the words in English. I'm sorry, you guys.
I know, it's okay. You speak very good English, by the way.
Thank you. I tried. To develop worse consequences from COVID than your average person. Okay, so we're not more likely to get COVID than anyone else, but we are more likely to get more severe consequences. Okay, so definitely wear a mask, practice social distancing, right? And keep taking care of yourself as you have, hopefully, till this day. I think that's the most important thing that I can tell you. And if you can, look for support, right? Basically, my page on Instagram is a place where the community of diabetics and other chronic illnesses come together. So just remember, you're not alone. You can always ask me anything you want, or if you just want to share something that's, going on in your life and that might be affecting your diabetes, definitely, the doors are always open. And it's usually that way with anyone that has another chronic illness.
Okay. Yeah, I appreciate that. Well, thank you so much. I think to all the viewers who are watching, who might watch, and who have diabetes, all right, somebody already said great advice. Thank you. Yeah, I mean, just help yourself by making sure you exercise, you take care of your nutrition and mental health, as Elisa is pointing out. And if you need community support, I mean, there are so many communities out there. And we are also coming out with wellness programs, next month in different ailments. And diabetes is one that we will be coming out soon as well. With that, thank you so much, everyone. Thank you, Elisa, for being with us. And to all the viewers, thank you for your support every single day. Help us share these sessions to help someone else you love. With that, I'd like to wrap up this session. This is Amita from Nourish Talk. Have a great evening. Bye-bye now.
Bye. Thank you.
Bye-bye.